If you are among the Americans who are currently using or planning to use any of the new GLP medicines for weight loss, then the purpose of this video is to help you to optimize your results. My name is Dr. Tom Rutledge. I'm a board-certified clinical health psychologist based in San Diego who specializes in metabolic health and healthy weight loss. I, like many of my colleagues around the country, are excited about this new generation of GLP medicines that, perhaps for the first time, offer a safe path to clinically meaningful weight loss for the millions of Americans in need. However, recent research has also highlighted some important limitations in regards to relying upon GLP medicines alone for your weight loss efforts. The purpose of this video is to highlight these limitations to you and offer you some proven strategies for minimizing the downsides and therefore optimizing your results. Let's talk about some evidence of which you may already be aware. Specifically, this study, like numerous others in the past several years, evidences that the typical person using any of the GLP medicines can expect to lose an appreciable and clinically significant amount of weight over 3 to 6 months or longer. Further, as indicated by this bar graph, a substantial subset, perhaps 50% or more of users of agents like semaglutide, can also expect to lose even more weight, such as 10, 15, or even 20%. And this might translate into, instead of 5 pounds to 10 pounds, 20 pounds, 30 pounds, or even larger amounts of weights for certain users. However, the emphasis point here is that these studies tend to emphasize overall weight loss. And that's something that we'll dive into here further. Let's take a step back for a moment to discuss weight loss more generally, that is not specific to GLP medicines. Traditionally, Americans lose weight through some sort of calorie reduction program. We typically call these diets. And while these differ in many important ways, the common path is that they involve a reduction of calorie intake. In some cases, people combine their calorie reduction program, their so-called diet, with some kind of exercise. And when they do, this is generally comprised exclusively of cardiovascular exercise, such as running, jogging, bicycling, etc. Now, studies show clearly that this path, this strategy works. People are able to lose weight on diet and exercise programs, at least as long as they were able to maintain the programs. However, studies that further look under the hood, that is, specifically look at what is called body composition, find that the results from this approach is often disappointing. That is, specifically, while people sometimes are able to lose a significant amount of overall weight, they often are losing less fat than would be ideal and a lot less of what's called lean tissue. And we'll delve further into that concept. Now, the typical American strategy for losing weight contrasts to what I'm calling here the professional weight loss approach. You might also think of this as the athletic weight loss approach. That is, how does a professional athlete lose weight? And they also reduce their calorie intake, but as you can see here, they specifically combine their lowered calorie intake with a high protein intake and progressive muscle resistance training exercise. And as a result of that different strategy, they obtain far better results, perhaps similar overall weight loss, but much improved body composition. And the takeaway point here is that optimally, whether you're using a GLP medicine or relying upon a traditional diet and exercise program, the goal is to not simply lose weight, but to maximize fat loss while maintaining your lean tissue. Whereas the typical approach, and as we'll see here, this unfortunately also applies to GLP medicines, the typical approach to weight loss often results in a seemingly meaningful amount of overall weight loss, but a disappointing and perhaps even concerning loss of lean tissue. Here are some evidence to back up what I'm describing for you. So this is a relatively recent review that used a technique called DEXA scanning, where they are able to differentiate the types of tissue that is changing in an individual going through a weight loss program. So the black bars here across different studies indicate the amount of fat loss, whereas the parallel white bar that is also accompanies each result shows the amount of lean tissue loss. Now, in an optimal result, and this was achieved in only one study that you see on the far left with liraglutide, you see only a small amount of lean tissue loss, whereas the overwhelming amount of overall weight that was lost in the study came from fat loss. Unfortunately, across all of the other studies, including the semaglutide trials to date, show that the amount of lean tissue loss is often at least 20% and often greater than 50% in some studies. So that would mean, for example, if a person had lost 10 pounds, that 3 to 5 pounds of that weight might come from their bones and their muscle tissue and other lean tissue. So what exactly is your so-called lean mass? Well, it sort of depends upon the technique that you're using to measure it. In the most simplistic fashion, for example, people in the military, they might have their body composition assessed through skin calipers. And skin calipers can estimate your body fat percent, meaning that everything that isn't your body fat is your so-called fat-free mass. So a very simple dichotomy. More sophisticated methods, such as an MRI or a DEXA scan, is in terms of related to the previous study, can differentiate lean tissue into multiple categories. Because what you can see here is that your lean mass means not just your muscle, but also your bone tissue, skin, cartilage, connective tissue, organs, and even blood, essentially everything in your body that is not fat tissue. What I'd like you to take away, though, is not all of the complex subcomponents of your lean mass, but to think about your lean mass, your lean tissue is really representing your quality of life. That your lean tissue is what enables you to be strong, healthy, functional, vital, to have energy, to be able to move and perform and engage in the activities that you desire in the world. So, for this reason, your lean tissue is sacred, precious, not something to negotiate with or be willing to accept any sort of appreciable loss. It's something that we should be striving to maximize in our early years of life and then protecting just as vigorously as we might our savings account or our retirement accounts. There are two populations that should be especially concerned about using a GLP agonist alone without combining some of the strategies that we will talk about here. The first population is the older age population. So you might think of this as, say, our retirement age population of 65 years and older. What you can see here, and this is captured in part in the figure on the right, is that as we age, we already tend to lose bone mass. And similarly, we also tend to lose muscle mass. When this is aggressive, it's called sarcopenia, that is older aged muscle loss that's at a greater rate than normal. The point being is that all things being equal, a person who is at an older age and is using a GLP medicine alone for weight loss, they already have a smaller reserve of lean tissue just because of the aging process. And that makes the remaining lean tissue that they possess all the more precious to maintain. The second group that's at particular risk are women. And this isn't just older age women who, of course, are at particular risk because of the combination of biological male-female differences as well as the aging process. Women also, because of their smaller body sizes, hormonal differences, they have approximately 10% muscle mass less on average compared to a man, and also less bone tissue, about 3 to 5% less bone tissue, which means that a woman at any age group already has less of a reserve of lean tissue and should therefore be all the more concerned whether they are using a traditional diet and exercise program or using a GLP medicine for weight loss to preserve, maintain, and perhaps even try to increase their lean tissue. Now let's look at several studies here that highlight some of the themes that I would like to translate into practical strategies for you. The first, and perhaps most important, is the importance of including progressive resistance training. And this obviously can refer to weight training. It can refer to calisthenics or other kinds of resistance training where you're using your body weight. What this study shows from 2011, this was an athletic population that was assigned to either a more or less aggressive weight loss program. So they were restricting their calorie intake either to a moderate degree or severe degree. The important thing is, however, that they were combining their diet with a vigorous resistance training program. And what you can see here, and this is what's captured in the red circle, is that by performing progressive resistance exercise program in combination with their reduced calorie diet, they were able to lose almost exclusively fat mass. That is, they were able to maintain and perhaps even modestly increase their lean mass while losing weight. This is a near optimal outcome. It's only achieved through combining a traditional reduced calorie diet or a GLP agonist with weight training or some other form of resistance training. Second takeaway that's very important is sleep. Sleep does not get enough attention when it comes to weight loss, but it should. And I go so far as to recommend that if a person doesn't have their sleep in order, that is, in terms of a quality sleep routine, use of a CPAP device if they have sleep apnea, postpone weight loss efforts until that area of their life is remedied. This is one of numerous studies showing the same result, in that in this particular randomized trial, people were assigned to either a reduced sleep condition or to a full night sleep condition. And what you can take away from these bars is that even though overall weight loss, when you averaged across the sleep conditions, look similar, that is, pre and post intervention, they might have stepped on a scale and showed an average similar weight loss between the groups. What the white bars indicate in particular is just what was lost. And the very sobering, perhaps frightening takeaway from this study was that approximately 75% or more of the overall weight loss for the average participant in the reduced sleep group came from their lean tissue. So a person might have lost 10 pounds, but 7 to 8 of those pounds on average was coming from their bones, from their muscles, and their other precious lean tissue. It's a completely unacceptable outcome, but also sobering when you consider just how many Americans, they're not in a study, but they're only sleeping 5 to 6 hours a night and yet trying to lose weight. The third, also very important point, is protein intake. The takeaway here is to, even when you're reducing calories, never reduce protein. And in fact, the studies suggest that you probably should be increasing your protein intake, especially when you're on a reduced calorie diet or you're using a GLP agonist and thereby eating less. What this study shows, among many others with similar themes, is that when people were randomized to either a more normal protein intake for a typical American, or in the bluish category, the high protein intake that approximates, if you're not comfortable with kilograms, approximates 1 gram of protein per pound of body weight. You can see here that the condition consuming high protein lost more fat mass and actually increased their lean mass. So combining a weight loss or calorie reduction or GLP program with a high protein diet is also very important for optimizing your results. The protein theme is particularly important for the older age groups, and that is because amongst the many biological vices of older age is that we synthesize protein less well. That means that consuming the same amount of protein among, say, a 65-year-old, their body would obtain less of a body protein synthesis response compared to a person at younger age. And that means that the older age person has got to consume even more protein. Now, keep in mind that the typical American tends to consume less and less protein as they age. So you're talking about an effect in a population that already tends to consume less protein, that tends to perform less resistance exercise, that tends to get less sleep. And now we're seeing here an additional biological disposition where they use even the limited amount of protein they're consuming less well than they did at younger ages. So if you're using a GLP medicine for weight loss and you're among the tens of millions of Americans who might be in the 65-year-old or older age group trying to lose weight, it's very important that you maintain or even increase your protein intake. Here's another study from the New England Journal of Medicine in 2018 looking at weight loss and the types of weight that was lost amongst people who were performing at the same time different types of exercise programs. So in this clinical trial, some were also performing aerobic exercise versus resistance exercise. The main theme that I would like you to remember from this study is what you can see highlighted in the red arrow. That is people losing weight. So they're on a calorie reduction program that's also coupled with aerobic exercise. Those individuals, unfortunately, lost 2 to 3 times as much lean mass compared to those performing resistance training, even though they lost similar amounts of overall weight. So it's not about overall weight loss. It's about what you're losing, what you're keeping. That's going to translate into your health, functionality, and quality of life later. So once again, it isn't just about exercising when you're losing weight or using a GLP medicine. It's also about specifically including resistance exercise to maximize the quality of your results. So let's summarize some of the takeaways here. So what we try to highlight is that The goal is to optimize your fat loss while maintaining your lean tissue. And that unfortunately, GLP medicines, when used alone, work much like standard low-calorie diet and exercise programs that Americans have practiced for decades. And that unfortunately, a large and often very concerning amount of the weight that is lost comes from lean tissue rather than fat. Thankfully, this can be prevented. Many studies over the last 10 years describing from rigorous clinical trials showing that, firstly, we want to combine any sort of weight loss program, but also certainly including a GLP program with practicing resistance exercise. Now, the nice thing is that resistance exercise can mean many things. It can mean body weight exercises, exercises like Pilates, any sort of body weight resistance training, and there are many and growing numbers of forms available these days. And of course, it can also mean using machines, dumbbells, barbells, traditional weight training in a gym setting or a gym at home. Ideally, this is performed at least once or twice a week, and the aim is to actually challenge your muscles. That it isn't just to go through the motions and do similar reps, but to really try to increase the strength of your muscles by challenging the major muscle groups at least a couple of times a week. Secondly, as mentioned, you want to combine your GLP medicine with a high protein diet. Protein is not negotiable. Even if you're reducing calories, if you're eating less, you want to at least keep your protein intake as high as it was before. That often means choosing different types of foods. You have to think about consuming a high quality protein source in every meal or using some sort of a protein supplement. Try to aim for at least 1 gram of protein per pound of your desired body weight. So that can mean 200 grams a day for a 200-pound person or a person who's aiming to be 200 pounds, or it can mean something like 150 grams per day for a person striving for a 150-pound weight loss goal. Thirdly, as mentioned, set up a regular sleep schedule. This means really 2 things. It means trying to practice a set routine where you're going to bed at a very similar time at night, waking up at a similar time each morning, and also trying to aim for 7 to 8 quality hours. Now, any step in that direction is going to improve your results. It isn't black and white, night and day. Strive to get better. Don't worry about being perfect. And then lastly, I thought it would be valuable to include some of the many different types of resistance training resources that are available on YouTube, on the internet, because this highlights a couple of things. Again, we tend to think of resistance training as narrowly limited to working out in a gym. And that certainly can apply. That is a terrific option for many people. However, it is limited to that. So instead, as you can see here, there's many types of body weight resistance programs. There's videos and resources for men versus women to highlight some of the differences, the different options that might be available or more friendly for people in different groups. If you have found this video useful, then I encourage you to discuss these resources with some of your healthcare providers and think about practical ways that you can implement them into your GLP efforts. Thank you for your time, and I wish you well.